Hello, my name is Julio Valdivia. I'm going to be performing a skill video for Nightingale College. I have my scrubs on, my ID badge. This skill video is going to be intradermal injection of tuberculin. Um, of course, when administering any type of medication, it's important to remember and keep in mind the 6 rights of medication administration, which are the right patient, the right drug, the right dose, the right time, the right route, and right documentation. With those things in mind, I'm going to be looking at my patient here, Mr. Smith. I don't know if I went over my supplies. I have my syringe, gauze pads, alcohol pads, my drug, clean gloves, Mr. Smith here, my patient, my hand hygiene, and a sharps container. Okay, so now I'm going to be pulling up Mr. Smith's MAR and look at his doctor's orders. He's been ordered a tuberculin dosage to test for the presence of tuberculosis in my patient. So now that I see that, I'm going to go ahead and pull my medication. I'm going to open the drawer and check that I need tuberculin. Look at my MAR, make sure that that's the right drug. I'm going to pull that drug out, hold it up to the MAR, make sure that I have the correct drug at the correct dose, which is 5 TU per 0.1 ml. Because this is an intradermal injection, I need, of course, my syringe, which is going to be a tuberculin safety syringe. It is measured up to 1.0 ml, 25 gauge, 5/8 inch, which is the correct and appropriate size syringe for this injection. So now I have my syringe. I'm bringing gauze pads and alcohol wipes, as well as my drug that I've checked up to my patient's MAR. And I'm going to head to my patient's room, set this down on the counter, close the door or the curtains behind me to provide patient privacy. I'm going to go ahead and perform hand hygiene, introduce myself to the patient. Hello, Mr. Smith. My name is Julio. I'm going to be your nurse today. How are you feeling today? Great. Can I get your full name and date of birth, please? Can I see your wristband, Mr. Smith? I'm going to verify my patient. Okay, thank you, Mr. Smith. I'm here to administer some medication, so I just want to know if you are allergic to any medications, foods, or anything from the environment. No known allergies? Okay, perfect. The drug I'm here to administer to you is a tuberculin. It is going to be for checking for the presence of tuberculosis. It's a test that we run that we're going to inject into your dermis, or the top layer of your skin. There are some side effects, which are swelling or itching at the site of the injection, as well as some more serious adverse effects, which are shortness of breath and an allergic reaction, which is hives, which can present itself as large red spots that are itchy. If you have any of those side effects or adverse side effects, you let me know, and I'll go ahead and take care of you, okay? Okay, and also whenever we do inject you with the medication, you might feel a slight stinging or burning at the injection site, but that should resolve itself shortly and is a normal occurrence when receiving an injection, okay? Do you have any questions for me at the moment? No? Okay, perfect. So now I've informed my patient. I've made sure that I have the correct patient. Now I'm going to deal with my drug. I'm going to have Mr. Smith's MAR open and again recheck that I have the correct drug up to the MAR. With that being said, I'm going to start to prepare the injection by loading my syringe with the drug. When doing so, I'm of course going to perform hand hygiene, don a set of clean gloves, remove the lid off my medication. I'm going to open a alcohol prep pad. I'm going to clean the top of my vial of tuberculin. Let that air dry. Throw my garbage away. Now for my syringe, I'm going to remove it from the packaging. Throw that away. Now before I withdraw the medication to the syringe, I need to administer 0.1 ml of air into the actual vial, because that's the amount of medication that I need, and it's going to assist the process of withdrawing the medication. So now that I have 0.1 ml of air in my syringe, I'm going to go ahead and uncap it, set it down on my workspace. I'm going to go ahead and inject the air into the vial. I'm going to flip the vial over and withdraw 0.1 ml of the medication to be administered, which is at the dose of 5 TU per 0.1 ml. I'm going to remove any air bubbles from my medication. Okay, I'm going to recap my syringe with one hand. Okay, that is 0.1 ml of medication in my syringe. That again is my tuberculin syringe, 1.0 ml, 25 gauge, 5-8 inch syringe and needle. I'm going to set that down. Now I'm going to locate the site of the injection for my patient. It's going to be on his inner forearm. It's going to be 4 finger lengths down from the bend of the elbow and 4 finger lengths up from the wrist in this section here. Now I'm going to go to my patient. I'm going to inspect the site. I'm going to check for any swelling, any rashes, or anything that would signal to me that an injection in that site is not appropriate. I'm also going to palpate the area and make sure that the injection site is viable for receiving the medication. I have now verified that that is a good site to do, so I'm going to remove my gloves and throw these away. And now I'm going to prep Mr. Smith for the injection. At this point in the process, you should have verified the patient, verified the drug, the dose, the route, and giving your patient knowledge of the injection. Asked him for any any allergies to medications, foods, or environment. You should have your medication ready, and now you and your injection site ready, or palpated, inspected. Now I need to clean the injection site before administering the medication. For that, I'm going to, of course, apply hand hygiene and don a set of new clean gloves. I'm going to open an alcohol prep pad and clean the injection site, starting from the center and working outwards about 2 inches. Okay, we'll throw that away. I'm going to let that air dry. Make sure not to blow or wave my hand above the injection site to speed up the process of that. I'm going to go ahead and let that air dry. For the sake of the time of the video, I'm going to go ahead and grab my syringe, uncap it. Now the bevel needs to be pointed upwards on the syringe, like such, when I am injecting. With my dominant hand, I'm going to hold the syringe like a pencil. I'm going to make sure the bevel is pointed upwards. I'm going to tighten the skin with my non-dominant hand and inject at a 5 to 15 degree angle, about 3 millimeters deep. Okay, now that I have that ready, I'm going to stabilize the syringe and inject the medication. Now, you should see a wheal or a bleb on the injection site once you have administered the medication. Now you're going to remove the needle, grab a gauze pad, and place it over the injection site. You are not going to apply any pressure, but just let any excess medication that comes up from the injection site to be absorbed by the gauze pad. Go ahead and throw that away. I threw away my syringe without recapping it, which is the correct way to do it. I have now injected the medication. I see the bleb. I'm checking for any adverse effects, immediate adverse effects. I can now remove my gloves, throw those away, perform hand hygiene. I will document the procedure. I will ask my patient if he has any questions for me at the moment. If he does, I will address those. If he doesn't, then that's okay. And we are done with the video. Of course, I would make sure I take the medication with me once I leave the room, and that's it.